Been an outbreak of the deadly Nipah virus in the Indian coastal state of Kerala. 5 people have caught the virus, 2 of whom have died. The authorities in the district where the outbreak occurred have instituted so-called containment zones and shut down schools. Now, at this stage, there are no reports of Nipah virus cases in South Africa. But should South Africans be worried about the outbreak? For more on this now, I'm joined by Dr. Jacqueline Weyer from the National Institute for Communicable Diseases, and she joins us virtually from Centurion. Doc, thank you so much for your time this afternoon. I came across the stories from international news organizations over the weekend when I started getting WhatsApp messages, especially from older family members who said, I hear that we're going into another lockdown. Is there another lockdown happening? And I very quickly had to check the main news resources, and the only thing I came across was the Nipah virus being reported in India. And a lot of it, of course, sounds very familiar: containment zones, people being tested and the like. Should we be worried about it? What do we know about the Nipah virus?
So at this stage, I think we are vigilant. We are monitoring the situation in India very closely. I guess at this stage we can say that we are cautiously optimistic that the outbreak has already been brought under control. It has been several days since the last case of Nipah has been confirmed in Kerala.
Now, what do we know about it? I do believe that there are respiratory issues that form part of the symptoms, but what do we know about the virus, how it presents, and what do we know about its genesis? Where does it come from?
Yes, so it's actually quite an interesting virus. We've actually known it for about 20 years, so it's been around for a while. It's a rare disease up to date. It's only been associated with outbreaks that's been reported from Malaysia, from India, and from Bangladesh. So no international spread in any of these outbreaks that have been documented in the past 20 years. So this is a very different virus. It's actually harbored naturally in certain species of bats. This particular species of bats are called flying foxes, and these animals are native to parts of Southeast Asia and the Pacific, and that explains why we've seen these outbreaks in this particular region. So as you've mentioned, yes, initially Nipah virus infection will present with respiratory symptoms, very much like you would expect with someone that contracted the flu. Many cases develop pneumonia, but what's more serious is that certain cases can also develop encephalitis, which is an inflammation of the brain. And in many of those cases, the patients do poorly.
And how can it be transmitted from human to human?
So the main mode of transmission is zoonotic, so that it means it spreads from animals, so those bats that we've been talking about, sometimes some other animals that can get involved in the picture as well. But as soon as the virus ends up in the human population, depending on the strain of Nipah virus that's involved in an outbreak, you can see limited human-to-human transmission. So what we've seen is that cases are usually close contacts. These are caregivers, family members, healthcare workers, and this is due to transmission that requires close contact with bodily fluids of an affected person, for example, blood, urine, respiratory secretions as well. This is not a virus that spreads in the same way as COVID-19. So yes, we do see human-to-human transmission, but it certainly hasn't behaved as jumpy, if you will, as COVID-19.
So that be the reason that you say you remain cautiously optimistic. How then do you keep tabs on it? Do you keep an eye on reporting via colleagues in your sector of the health system in India? Is there something that you need to make government aware of? Do we need to keep track of people traveling in and out of that area in India? How do we keep tabs on something like this so that we know that we can continue to feel cautiously optimistic of its potential non-spread?
Absolutely. So as you've mentioned, there's quite a lot of conversations going on, monitoring from different sources, and trying to see how the outbreak develops. The optimistically or the cautiously optimistic reference is bearing to the fact that we haven't seen any new cases being reported in the last couple of days. That's really good news. I also can, I think we can commend the Indian authorities that really reportedly responded quite intensively and comprehensively. You've mentioned some of those measures, really reminding us of lockdown days, closing down transport, delaying events, schools are closed, tourism has been interrupted to these areas. They've really responded quite quickly and quite comprehensively. So we trust that this will bring this outbreak under control swiftly.
Okay, thank you so much. Great to get the information from the best place possible, the National Institute for Communicable Diseases. Dr. Jacqueline Weyer is joining us virtually there from Centurion. Thank you so much.